integrase strand transfer inhibitor. These drugs include Raltegravir, dolutegravir, elvitegravir, and it's treated for naive patients. It could not be metabolized by cytochrome and can undergo glucuronidation. If used with rifampin, because rifampin can induce UDP glucuronosine transferase, the dose should be doubled. It can bind with integrase, common to and essential to both HIV-1 and HIV-2. By inhibit strand transfer and integration of rDNA into host cells is inhibited. Protease inhibitors. Protease inhibitors are function on the late protein synthesis and processing. Protease inhibitors are used commonly in HAART. It has significant disorders in carbohydrate metabolism and may be due to inhibition of lipid-regulating proteins. It has signs similar to HIV protease. PI syndromes occurred in 50% of patients on protease inhibitors for 1 year. It can increase truncal obesity, buffalo bump, gynecomastia. It has facial and peripheral lipodystrophy, and it can induce hyperglycemia, insulin resistance, and it can elevate lipids. Alazanavir, it is used once daily and requires acidic environment. Penetrate barriers. It cannot. They can penetrate blood-brain barriers, so we sometimes see them in the central nervous system and in the seminal fluid, which is quite relevant in terms of sexual activity for our patients. It is also excreted in the bile. The toxicity include GI distress, elevated bilirubin, but not elevated cholesterol and triglycerides, and it has peripheral neuropathy and skin rash. Darunavir, DRV, corbistate, boosted darunavir, DRV, C. Ritonavir, boosted DRVR, are used in combination with other drugs to boost effectiveness, and need to be used with caution in patients with sulfur allergy. Sulfur allergy is induced by sulfonamide. DRV, DRVC, DRVR's toxicity include liver toxicity and skin rash. The next protease inhibitors are Fosamprenavir, amprenavir. Fosamprenavir is the prodrug of amprenavir. They are used in combination with other drugs like Ritonavir to boost the effectiveness, and need to use when used with patients with sulfur allergy need to be cautioned. The toxicity include GI distress, skin rash, paresthesias, and remember that these The suspension agent is propylene glycol, so we tend now to use this agent in pregnancy and in kids. Ritonavir is probably one of the best known of the protease inhibitors, and if my memory serves me correctly, take it with meals cleared by the liver. It's often used to boost other medications due to its ability to inhibit metabolism. Now, at subtherapeutic doses, we can still inhibit the metabolism of other protease inhibitors like integrase and etc. The toxicity include GI irritation, bitter taste, elevation of transaminases, cholesterol, triglycerides, skin rash, paresthesias. Saquinavir is combined with Ritonavir, and it is also used both as a substrate and an inhibitor of the cytochrome system, so that once again it is improving the efficacy of other agents. Toxicity with this is nausea, vomiting, diarrhea, and dyspepsia, very similar to other agents. And we have new agents. Tipranavir is a new drug and it combined used with Ritonavir. We used it as a substrate and an inducer of cytochrome P450 systems, and we also can induce P-glycoprotein. Now, there is an increased risk of rhabdomyolysis with HMG-CoA reductase inhibitors or stenting. So be very aware that if we are going to be starting patients on this new agent, I think that it is worthwhile just stopping stenting if the patients are on stenting already. The toxicity of Tipranavir includes nausea, vomiting, liver toxicity, skin rash, paresthesias,